Okay, good evening to one and all. Once again, welcome back to our YouTube channel and the Nursing Live beta. So we are live right now, beta. Good evening, Girish. Good evening, Priyanka, Pradeep. गुड इवनिंग सागरिका। फटाफट टी वीडियो को लाइक कर दियो बेटा, फटाफट वीडियो लाइक कर दियो। जो मैंने लाइव आसी जाइए फटाफट वीडियो को लाइक कर दियो। ओके, गुड इवनिंग टू वन एंड ऑल। वंस अगेन वेलकम बैक टू आवर यूट्यूब चैनल। एटा जो मैंने लाइव आसी जाइए वीडियो को लाइक कर दियो, शेयर कर दियो एवं जो मैंने फर्स्ट टाइम चैनल को देखुछ निहाती भाव चैनल को सब्सक्राइब मध्य कर दियो, राइट। लाइक कर दियो बेटा फटाफट। जति जन भी लाइव आसी जाइए वीडियो को लाइक कर दियो, प्लीज लाइक कर दियो। ओके, हमें बहुत गुड़ाए क्वेश्चन अच्छे देखिबार अछि बेटा। और डेरी करवानी, स्टार्ट करवा क्लास, राइट। So question number 531 is all of the following are included in the bundles of care for ventilator associated pneumonia except option is head elevation at 30 to 45 degrees, option B is peptic ulcer disease prophylaxis, option C is sedation interruption, option D is antibody administration. So which option is the correct answer? Which option is the correct answer? So correct answer is antibody administrations, right? Correct answer is antibody administrations. ये कुछ छाड़ी दिले बेटा, all are the bundle of care for ventilator associated pneumonia, right? Head elevation at 30 to 45 degree angles, peptic ulcer disease prophylaxis, sedation interruptions, ये सब हेला bundle of care for VAP, bundle of care for VAP, ventilator associated pneumonia, right? Except antibody administrations. Next question, question number 532 is beta inflammatory mediators not involved in the pathogenesis of asthma is called. Inflammatory mediators not involved in the pathogenesis of asthma is called. Option A रची adrenaline, option B रची prostaglandins, option C रची leukotrienase, option D रची histamine. So which option is the correct answer? So correct answer is option A. Option A is the correct answer. This is not involved. So adrenaline not involved in the pathogenesis of asthma, right? Inflammatory mediators not involved in the pathogenesis of asthma is called adrenaline. But option A is the correct answer, right? Option A is the correct answer. Next question, question number 533. बाकी सब बेटा prostaglandins, leukotrienase, histamines all are involved in the pathogenesis of asthma, right? Prostaglandins and leukotrienes, histamines. These all are the inflammatory mediators involved in the pathogenesis of asthma, right? Adrenaline ko chhadi ki, right? Next question, question number 533. Which one of the following entities is not included in COPD? Which one of the following entities is not included in COPD? Option A is asthma, option B is chronic bronchitis, option C is emphysema, option D is pneumonia. So which option is the correct answer, beta? So correct answer is option D, pneumonia. Pneumonia not included in COPD, right? Pneumonia is an infection. हाँ ना बेटा, infections inflames both the lungs. हाँ ना, that is pneumonia inflames both the lungs. Next question, question number 534. Which of the following cannot cause a false pulse oximeter reading in a patient with respiratory distress? Which of the following cannot cause a false pulse oximeter reading in a patient with respiratory distress? Option A is inadequate peripheral circulations, option B is edema, option C is hyperthermia, option D is nail polish. So which option is the correct answer? Which option is the correct answer? बड़ा आंसर करो. Which of the following cannot cause a false pulse oximeter reading in a patient with respiratory distress? Nail polish the better false pulse oximeter reading asibo nail polish re cannot cause a false pulse oximetry reading. Inadequate peripheral circulations edema thile proper pulse oximetry reading asibani when patient with respiratory distress. So option C is the correct answer, beta. Option C, hyperthermia cannot cause a false pulse oximetry reading in a patient with respiratory distress. Option C is the correct answer. Option C is the correct answer, beta. Next question, question number 535. A red velvety precancerous lesion on the mouth is called. Option B oral thrush, option B aphthous stomatitis, option C erythroplakia, option D leukoplakia. So which option is the correct answer? So a red velvety precancerous lesion, a red velvety precancerous lesion on the mouth is called erythroplakia, beta. Option C is the correct answer. Erythroplakia. Erythroplakia. Next question, question number 536. Cloacal malformation of anorectal defects is classified into option is high, option is intermediate, option C is very high, option is low. Cloacal malformation of anorectal, when where the rectum, urinary and genital tract merge into a single channel, and it is generally classified as a high anorectal classifications, sorry, high anorectal malformation, right? So which option is the correct answer? Option A is the correct answer. Option A is the correct answer. Next question, question number 537. Which of the following, फटाफट आंसर करको पड़ो बेटा, आज बहुत गुडा क्वेश्चंस हमें कवर अप करबा. क्वेश्चन नंबर 537 फटाफट आंसर करबा हला. Which of the following hormonal problems leads to hypoglycemia? Which of the following hormonal problems leads to hypoglycemia? फटाफट आंसर करो बेटा. Increase calcitonin, option B is increase cortisol, option C is increase insulin, option D is increase glucagon. So which option is the correct answer? Which option is the correct answer? Which of the following hormonal problems leads to hypoglycemia? फटाफट आंसर करो. Option C is the correct answer. Hormonal imbalance. Maximum insulin in the bloodstream hele beta kon habo? It causes body to absorb too much glucose from the blood, ana nai तेणु करी कोन हे बेटा लो ब्लड शुगर लेवल हे जिवो, से पे इंक्रीज इंसुलिन हेले कोन होची बेटा हार्मोनल प्रॉब्लम्स हबो एंड इट लीड्स टू हाइपोग्लाइसेमिया. मन रखते बेटा ऑप्शन सी इज द करेक्ट आंसर, राइट. वेरी इंपोर्टेंट एमसीक्यू, वेरी इंपोर्टेंट एमसीक्यू, 5 स्टार एमसीक्यू फॉर योर नॉर्सेट एग्जामिनेशन एंड OSSC नर्सिंग अफसर एग्जामिनेशन. हला बेटा अरे बेटा मन रख मु कहली पर तुम हाइपरग्लाइसेमिया इंसुलिन इंक्रीज सेटा को नै जेते बेले ब्लड स्ट्रीम रे हाई टू मच इंसुलिन हे जीवो तापरे कोन करबो बॉडी कोन करबो या को एब्जॉर्ब करा पय चाहेबो ना, एब्जॉर्ब टू मच ग्लूकोज फ्रॉम द ब्लड माने नै एंड तापरे कोन हबो धीरे धीरे लो ब्लड शुगर लेवल हबो. So correct answer is option C. Next question, question number 538. What is the condition characterized by the overproduction of growth hormone called? Option A Graves' disease, option B goiter, option C pituitary hypocretions, option D acromegaly. So which option is the correct answer? फटाफट आंसर करो. What is the condition characterized by the overproduction of growth hormone called? So correct answer is option D. But option D is the correct answer, right? Acromegaly is a hormonal disorder. Acromegaly is a hormonal disorder. Ana nai for overproductions of growth hormone. Overproduction of growth hormone is called कौन बेटा acromegaly. मन रखी तो overproduction of growth hormone is called acromegaly. हाँ ना नहीं 5 star MCQ मन रखी तो बेटा very important. Right? आमो OSSC nursing officer exam पे important. Acromegaly. Overproduction of growth hormone or GH by the pituitary gland, है ना नहीं by the pituitary gland. तो कौन होगा बेटा acromegaly होगा, right? Next question, question number 539. A 17-year-old girl complains of irregular menstruations, constipations, weight gain, lethargy and intolerance to cold. The girl is suspected of having. A 17-year-old girl complains of irregular menstruations, constipations, weight gain, lethargy and intolerance to cold. The girl is suspected of having. Option A hypopituitarism, option B hypothyroidism, option C hyperthyroidism, hypothyroidism and hyperpituitarism. So which option is the correct answer? So correct answer is beta hypothyroidism, right? Hypothyroidism. Option B is the करेक्ट आंसर हाइपोथायरॉयडिज्म रे कोन होची बेटा इरेगुलर मेंस्ट्रुएशंस हबो कन्स्टिपेशंस हबो वेट गेन हबो अना नहीं लेथार्जी हबो एंड cold intolerance haba beta cold intolerance haba these all are the classical sign and symptoms of hypothyroidism these all are the classical sign and symptoms of hypothyroidism, right? Next question, question number 540. The condition produced by excessive endogenous or exogenous thyroid hormone is the condition produced by excessive endogenous or exogenous thyroid hormone is option is thyrotoxicosis, option is Addisonian crisis, option is mixed edema, option is cretinism. So which option is the correct answer? Which option is the correct answer? Which option is the correct answer beta? So correct answer is beta thyrotoxicosis, the condition produced by excessive endogenous or exogenous thyroid hormone is called thyrotoxicosis, right? Next question, question number 541. Which of the following hormone plays a key role in regulating glucose metabolism? Very, very important. Which of the following hormones play a key role in regulating glucose metabolism? Option is insulin, option is glucagon, option is adrenaline, option is thyroxine. So which option is the correct answer? So insulin hormone plays a key role in regulating glucose metabolism in the body, है ना नहीं? And insulin के produced करछे बेटा? Insulin produced by which organ? Insulin produced by pancreas, है ना नहीं? Insulin produced by pancreas. Okay, next question, question number 542. Which of the following disease is also known as pituitary cachexia? Which of the following disease is also known as pituitary cachexia? Option is Simon's disease or Simon's disease. Option B is Cowden disease. Option C is Sihon syndrome. Option D is pheochromocytoma. Which of the following disease is also known as pituitary cachexia? Option is Simon's disease, option B is Cowden disease, option C is Sihon syndrome, option D is pheochromocytoma. So which option is the correct answer? Which option is the correct answer beta? ये सब नॉर्सेट वाला क्वेश्चंस बेटा, नॉर्सेट वाला important questions, right? So Simon's disease is a chronic deficiency of function of the pituitary gland, है ना नहीं? Chronic deficiency of function of the pituitary gland, and this is a form of hypothyroidism, and this is a form of hypothyroidism beta. Okay, so option A is the correct answer. Option A is the correct answer beta. Option A is the correct answer. Next question, question number 543. Which of the following hepatitis virus is classified as a DNA virus? Which of the following hepatitis virus is classified as a DNA virus? Option A is hepatitis A virus, option B is hepatitis E virus, option C is hepatitis C virus, option D is hepatitis B virus. So which option is the correct answer beta? Which option is the correct answer? Hepatitis virus is classified as a DNA virus called hepatitis B virus. Hepatitis B virus. Option D is the correct answer, right? And other viruses like hepatitis A, hepatitis E, hepatitis C, and आउ कौन बेटा अच्छी क्या हो नहीं hepatitis A, hepatitis E, and hepatitis C virus are RNA virus, right? But hepatitis B virus is a DNA virus, right? मन रखिता बेटा. नेक्स्ट क्वेश्चन ये सब नॉर्सेट वाला क्वेश्चंस बेटा मन रखी था ये सब क्वेश्चंस आसी पारे. क्वेश्चन नंबर 544. A condition where the pituitary gland is flattened or deformed, potentially affecting its function, is known as. A condition where the pituitary gland is flattened or deformed, potentially affecting its functions, is known as. Option A empty sella syndrome. Option B Hashimoto's disease. Option C Simon's disease. Option D Sehon's syndromes. Which option is the correct answer? Empty sella syndrome, ESS. Empty sella syndrome, ESS. ESS is a condition where the pituitary gland is flattened or deformed, potentially affecting its functions, right? So option A is the correct answer. Next question, question number 545. In a patient with diabetic ketoacidosis, which laboratory value requires the most immediate interventions? In a patient with diabetic ketoacidosis, DKA. In a patient with DKA, which laboratory value requires the most immediate interventions? Option A blood glucose of 490 milligram per deciliter. Option B serum potassium of 2.8 milliequivalent per liter. Option C serum bicarbonate of 12 milliequivalent per liter. Option D atrial pH of 7.25. So which option is the correct answer beta? Which option is the correct answer? In a patient with diabetic ketoacidosis, that is DKA, so which listed laboratory values are significant or require attentions? That is serum potassium 2.8 milliequivalent per liter beta. Option B is the correct answer. A value को हमें most immediate interventions value, right? It requires immediate or most immediate interventions, right? Kaina beta, this is a severe hypocalcemia, severe hypokalemia conditions. हाँ ना नहीं, पेशेंट को severe hypokalemia हवा को गलानी बेटा, severe hypokalemia हवा को गलानी. तो पेशेंट्स को कौन हवा बेटा? जदि या को हमें करेक्शन करिबानी कार्डियक एरिथमिया हवा बेटा, कार्डियक एरिथमिया हवा. जदि हमें या करेक्शन करिबानी ताहले कार्डियक एरिथमिया हवा बेटा. हाँ नहीं. So जल्दी हमें यहाँ पाएं किसी करियर को पढ़िबा. So most immediate interventions required to this laboratory values, right? Option B is the correct answer. Next question, question number 546. Which of the following is a rare disease in which tumors cause the stomach to produce too much acid, resulting in peptic ulcer? Option A रही बेटा. Option A रही Boyer-Haff syndrome. Option B Zollinger-Ellison syndrome. Option C Mallory-Weiss syndrome. Option D abdominal compartment syndrome. ये सब क्वेश्चन सब नॉर्सेट वाला क्वेश्चंस बेटा, मोस्ट इंपोर्टेंट नॉर्सेट वाला क्वेश्चन सब, राइट? सो व्हिच ऑप्शन इज द करेक्ट आंसर? व्हिच ऑप्शन इज द करेक्ट आंसर? So correct answer is option B, Zollinger-Ellison syndrome. It's a rare conditions by the development of one or more tumors in the pancreas or small intestines. The pancreas and or small intestine. Okay. So option B is the correct answer. But next question, which is an inherited disease of the mucus and sweat glands and affects lungs, pancreas, liver, intestine, sinuses, and sex organ? Which is an inherited disease of the mucus and sweat glands and affects lungs, pancreas, liver, intestine, sinuses, and sex organs. Option is cystic fibrosis, option is celiac disease, option C is galactosemia, option D is phenylketonuria. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दो. So correct answer is बेटा cystic fibrosis. Option A is the correct answer. Cystic fibrosis is an inherited disease of the mucus and sweat glands. Option A is the correct answer. Very good, Girish Mahapatra, Suchitra. Next question, question number 548. The cytoplasmic hyaline inclusion of liver cell. The cytoplasmic hyaline inclusion of liver cell mainly seen in alcoholic hepatitis and also occur with non-alcoholic steatohepatitis and Wilson disease. Each option is Cocker's bodies, option B is Arb's bodies, option C is Mallory bodies, option D is King's bodies. So which option is the correct answer? Which option is the correct answer? So correct answer is Mallory bodies, beta. Mallory bodies are cytoplasmic hyaline inclusions found in liver cells and that are seen in various liver disease. That are seen in various liver disease, beta, right? Mallory bodies seen in various liver disease. Next question, question number 549. The non-rhythmic tremors in the wrist. The non-rhythmic tremors in the wrist and fingers in chronic liver disease (CLD) are termed as option is caput medusia, option B is ataxia, option C is asterixis, option D is Sydenham's chorea. So which option is the correct answer? Asterixis is the correct answer, but option C is the correct answer. Asterixis. In chronic liver disease, non-rhythmic tremors occurring in the wrist and finger are called asterixis. Right? Option C is the correct answer. Option C is the correct answer. Very, very most important MCQ for you, beta. For your upcoming OSSC nursing officers exam. This question is most important. Next question also most important, 5-star question. This is also 5-star MCQ for your upcoming OSSC nursing officers exam, beta. Diabetes insipidus is due to the deficiency of option is insulin, option is vasopressin, option C is glucose, option is glucagon. So which option is the correct answer? फटाफट आंसर कर दिया बेटा. So diabetes insipidus is caused by deficiency of vasopressin and this is also known as antidiuretic hormone ADH, antidiuretic hormone, antidiuretic hormone, also known as antidiuretic hormone, also known as antidiuretic hormone. Option B is the correct answer. Very good, very good. Next question. Question number 551. The nurse monitors a patient of acute pancreatitis. Which assessment finding indicates the paralytic ileus has developed? Option A, inability to pass flatus. Option B, loss of anal sphincter control. Option C, severe constant pain with rapid onset. Option D, form non-tender mass palpable at the lower right costal margin. So which option is the correct answer? The nurse monitors a patient of acute pancreatitis. Which assessment finding indicates the paralytic ileus has developed? So which assessment findings the paralytic ileus has developed? So co option haba beta correct option. So form non-tender mass palpable at the lower right costal margin is the correct answer. So option D is the correct answer, beta. Right, option D is the correct answer. Next question, question number 552. Pen on dip inspirations. Pen on deep inspiration. When an inflamed gallbladder is palpated by pressing the fingers under the rib cage is known as very important. Very important MCQ. Option A Rovsing signs. Option B Soas sign. Option C McVarnish sign. Option D Murphy signs. So which option is the correct answer? So Murphy sign is a physical test used to diagnose acute cholecystitis. Murphy signs. Murphy signs is a physical test used to diagnose acute cholecystitis. Right? Option D is the correct answer, beta. This option is the correct answer. Option D is the correct answer. Pen on deep inspiration. When an inflamed gallbladder is palpated by pressing the fingers under the rib cage is known as Murphy signs. Murphy signs. Next question. Question number 553. Which of the following equation is used to measure the resting metabolic rate in healthy individuals? Option A Harris Benedict equations. Option B Mifflin Saint George equations. Option C Ramsey equations. Option D TEE equations. So which option is the correct answer, beta? So correct answer is option A Harris Benedict equations. Harris-Benedict equation is a widely used method to estimate an individual's basal metabolic rate or BMR or BMR, and which is closely related to metabolic rate. So option A is the correct answer. Next question, question number 554. The optimal target for patient with diabetes mellitus is maintaining glycated hemoglobin HbA1c. Maintaining a glycated hemoglobin HbA1c at option A रही बेटा above 6.5%, option B रही below 6.5%, option C रही above 9%, option D रही below 9%. बेटा आंसर कर दे बेटा, फटाफट आंसर कर दे बेटा, फटाफट आज अब समय नहीं, फटाफट आंसर कर दे बेटा। आंसर कर दे बेटा फटाफट। डायबिटिक, pre-diabetic and normal HbA1c कितने कितने बेटा वैल्यू नॉर्मल HbA1c कितने बिलो 5.7% or less than 5.7%. pre-diabetic conditions रे बेटा 5.7% to कितने बेटा 6.4% and diabetic कितने बेला हमें कहवा बेटा above 6.5%, हाँ ना नहीं above 6.5%। above 6.4%, हाँ ना नहीं 6.5%, above 6.5% और हायर, हाँ ना नहीं हेले आमे डायबिटिक कहूँ. So which option is the correct answer, beta? The optimal target for patient with diabetes mellitus is maintaining a glycated hemoglobin HbA1c. कितने बेटा correct answer? So correct answer is option B, beta. Option B is the correct answer. Below 6.5% हमको रखिवार अच्छी है ना HbA1c. Optimal target for patient with diabetes mellitus DM patient. Option B, very good, very good. Sweetie Dhal, option B. Good evening, Kaveri Malik. Barsa Rani Naik, option B. Girish Mahapatra, option B. Pradeep Tagore, option B. Jaswini Shah, option B. Very good, बहुत बढ़िया आंसर कर. Next question, question number 555. Phenylketonuria is detected by which urine test? बेटा फटाफट आंसर करो, बहुत important MCQ बेटा. This is very very important MCQ. अब बेटा एक क्वेश्चंस को माने रखे था. This is the 7-star 8-star वाला क्वेश्चंस है मन रखी था. सब एग्जाम रे आसी, OSSC एग्जाम रे आसीबो एंड ऑरसेट एग्जाम रे आसीबो, राइट. HbA1c रा नॉर्मल वैल्यू मन रखियो पड़िबो. नॉर्मल वैल्यू प्री डायबिटिक कंडीशन रे केते रेंज रहे, डायबिटिक कंडीशन रे केते रहउची मन रखियो पड़िबो, राइट. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 555. Phenylketonuria is detected by which urine test? Option is Guthrie's test, option B रचे sodium nitropruside's test, option B option C रचे blood test, option C option C रचे blood test, option D रचे ferric chloride test. So option A रचे Guthrie test, option B रचे sodium nitroprusside test, option C रचे blood test, option D रचे ferric chloride test. So which option is the correct answer, बेटा? So correct answer is ferric chloride test. Option D is the correct answer. Ferric chloride test. So this is otherwise known as beta Liebist test. How कौन कौन दे बेटा? और phenestics test भी कौन दे बेटा, right? Ferric chloride test को आओ कौन कौन थे? Liebist test और phenestics test कौन थे बेटा? Phenylketonuria is detected by which urine test? Ferric chloride test और Liebist test और phenestics test को आ जाए बेटा, right? मन रहेला बेटा. Next question, question number 556. Epidemic dropsy is due to. Epidemic dropsy is due to. Option is BOAA. Option B is sanguinarine. Option C is ergot. Option D is aflatoxins. So correct answer है बेटा sanguinarine, right? Sanguinarine. So epidemic dropsy is a disease caused by consumption of edible oil, consumption of edible oils and contaminated with sanguinarine, contaminated with sanguinarine. Right? Epidemic dropsy is caused by consumption of edible oils, and it is contaminated with, when it is contaminated with sanguinarine. Right? Next question, question number 557. The clinical manifestation of Cushing syndromes are, the clinical manifestation of Cushing syndromes are option B moon face and truncal obesity, option B hypotension and dizziness, option C hyperkalemia and peripheral edema, option D anorexia and weight loss. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दिया बेटा. Which option is the correct answer? Which option is the correct answer बेटा? फटाफट आंसर कर दो. The clinical manifestation of Cushing syndrome are option A moon faces and truncal obesity, option B hypotension and dizziness, option C hyperkalemia and peripheral edema, option D anorexia and weight loss. So which option is the correct answer? So correct answer is moon faces. Cushing syndrome कौन होची बेटा? एक्सेसिव कॉर्टिजल हो जाउची, हां ना नहीं, ता द्वारा राउंड फेसेस हो जाउची एवं मून फेसेस हो जाउची. राइट? एक्सेसिव कॉर्टिजल हो जाउची, एक्सेसिव और एक्सेस कॉर्टिजल जोगु कौन हो जिवो बेटा? मून फेस हो जाए, राउंड फेस हो जाए. एंड आउ कौन हो जाए बेटा? एंड फेट एक्यूमुलेशन अराउंड द ट्रंक, फेट एक्यूमुलेशंस, फेट excessive cortisol जोगु मून फेस हवा बेटा. राइट? मून फेस हवा एंड फेट accumulations around the trunk and upper back एई थी जोगु बेटा एई पाई कौन हबो? ट्रुंकल ओबेसिटी है जीवा. ट्रुंकल ओबेसिटी और कौन कहते बेटा? बफालो हम्प seen in Cushing syndrome. क्वेश्चन आसे बेटा, बफालो हम्प seen in Cushing syndrome, moon faces seen in Cushing syndrome. बफालो हम्प मून फेस माने रखी था बेटा. बफालो moon faces and buffalo hump. This is the clinical manifestation of Cushing syndrome. Right? मन रहिला बेटा very important MCQ for your NORSET and your OSSSC nursing officers exams. Next question, question number 558. Disorder caused by lack of insulin. Disorder caused by lack of insulin. Very important. Very important and very important. Option A diabetes insipidus. Option B diabetes mellitus. Option C goiter. Option D hypercorticism. Disorder caused by lack of insulin is diabetes mellitus. Diabetes mellitus. नहीं बेटा? ठीक तो वेरी गुड. अरे आंसर कर यार, सोई पड़ल कि समझते एबेठू निद लगिले केमती हम बेटा? 10टा हेनी कि 11टा हेनी बेटा? सब नर्सिंग ऑफिसर हवार इच्छा अच्छी ना नहीं? इच्छा अच्छी तो ताहले सोई पड़नी बेटा. समझते जागी उठो. राइट? जागो ग्राहक जागो. यदि आपको नर्सिंग ऑफिसर्स, गवर्नमेंट नर्सिंग ऑफिसर्स बनना है तो जगना पड़ेगा. सोइला पुअर भाग नाई. तमरा गोटे सीट के नहीं जीवा बेटा. राइट ना? 5989 ना 98, 5989 ना 98 सीट अच्छी. कितना सीट अच्छी बेटा? 5989 सीट तो नहीं जीवन ना किए गोटे से सोई पड़नी. जग के रहना पड़ेगा, हाँ कि नहीं? नहीं तो कोई लेके चला जाएगा हमारे पोस्ट सब, हाँ कि नहीं? यस और नो, पढ़ाई करना पड़ेगा ना, सो जाने से तो नहीं होगा, होगा क्या? नहीं होगा ना। ओके, करेक्ट आंसर इज डायबिटीज मेलाइटस, राइट? Next question, question number 559. What is the absolute contraindication of liver biopsy in children? What is the absolute contraindication of liver biopsy in children? Option A coagulopathy, option B tumor in liver, option C pneumothorax, option D bleeding. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta coagulopathy. Option A is the correct answer, right? Coagulopathy. This is the absolute contraindication of liver biopsy in children. Next question, question number 560. Question number 560. In a patient with acute appendicitis, the nurse should anticipate which of the following treatment? Option A, application of heat on the abdomen. Option B, administration of enema to cleanage. Option C, insertion of nasogastric tube. Option D, placement of client on NPO or NBM status. So which option is the correct answer? Which option is the correct answer? So correct answer is placement of gland on NPO. In a patient with acute pancreatitis, the nurse should anticipate which of the following treatments? Placement of gland on NPO or NBM status or NBM status. NBM माने कौन बेटा? Nothing by mouth, nothing by mouth. NPO नील पर ओरल, नील पर ओरल, ये सब मन रख है, भूली गले हम ना। प्लेसमेंट ऑफ क्लाइंट ऑन नील पर ओरल और नथिंग बाय माउथ, राइट? So option D is the correct answer. Next question, question number 561. Deficiency of antidiuretic hormone leads to very important MCQ. Very important MCQ. Deficiency of the antidiuretic hormone leads to option A diabetes mellitus, option B diabetes insipidus, option C ketoacidosis, option D pellagra. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर करो मेरे प्यारे दोस्तों, डियर फ्रेंड्स, आंसर करो। नहीं आंसर करोगे तो कैसे होगा? फटाफट आंसर कर दिया, फटाफट आंसर करो यार, फटाफट आंसर कर दो। तुम लोग ना आंसर भी नहीं करते हो भाई। So correct answer is which options? Very good, very good. Option B is the correct answer. Sorry, option B is the correct answer. Diabetes insipidus. यशस्विनी शाहू, गिरीश महापात्र, प्रदीप तगुड़, नित्य प्रकाश भुइया, स्निग्धा, सागरिका, डायबिटिस इंसिपिडस। वेरी गुड। डायबिटिस इंसिपिडस कौन हुए बेटा? एक्सेसिव थर्स्ट हुए, वेट लॉस हुए, वॉमिटिंग हुए, फीवर हुए, कॉन्स्टिपेशन हुए, डायबिटिस इंसिपिडस रे। बट डायबिटिक मेलाइटस रे कौन हुए बेटा? Deficiency of the antidiuretic hormone leads to diabetes insipidus diabetes insipidus रे excessive thirst होची weight loss होची vomiting होची fever होची constipation होची है ना नहीं so diabetic mellitus रे कौन हुए बेटा polyuria polydipsia आउ कौन होची and polyphagia 3p होची ना 3p DM रे कौन हुए 3p हुए 3p कौन कौन बेटा polyuria polydipsia and polyphagia polyphagia means increased hunger हाँ ना नहीं increased hunger है ना नहीं polydipsia कौन बेटा excessive thirst आना नहीं माने अच्छी तो polyuria कौन बेटा frequent urination बार बार परिश्रा लगी बेटा frequent urinations ये हेला 3 P's in diabetic mellitus आना नहीं मन रहिला तो ब्लड विजन होची बेटा फैटिक हबो वीकनेस हबो एला जेहेतु बार बार यूरिनेशन होची tingling numbness tingling sensation हबो एला next question number 562 hypothyroidism in adult is called option A is cretinism option B is mixed edema option C is Graves disease option D is Addison's disease very important MCQ आंसर कर दियो बेटा फटाफट आंसर कर दियो hypothyroidism in adults is called mixed edema option B is the correct answer mixed edema is the correct answer beta severe hypothyroidism is called mixed edema right option B is the correct answer next question number 563 what would be the possible manifestation in patient who is suffering from diabetic coma option is moist skin and sweating option is hyperglycemia option C is excessive thirst option D is decreased urination so correct answer कौन हम बेटा the possible manifestations this is hyperglycemia हाँ बेटा hyperglycemia the possible manifestation in patient who is suffering from diabetic coma कौन हम बेटा hyperglycemia so blood pressure dangerous when high be hele dangerous and low hele be dangerous beta both आना नहीं next question number 564 which of the following clinical features seen in a client with Addison disease option A puffy face option B hyperpigmentation option C rashes on skin option D weight gain so which option is the correct answer which of the following clinical features seen in a client with Addison disease which option is the correct answer which option is the correct answer so correct answer is hyperpigmentation हबो बेटा एडिशन डिजीज रे कौन होची बेटा हाइपरपिगमेंटेशन हुए वेट लॉस भी हबो बेटा वेट लॉस भी हुए माने रखे तो वेट लॉस हबो लॉस ऑफ एपिटाइट हबो लॉस ऑफ एपिटाइट माने कौन बेटा लॉस ऑफ एपिटाइट मींस एनोरेक्सिया माने अछि तो बेटा ए सब टर्म गुडा को माने रखिवर अछि हाइपोटेंशन हबो hypotension हबो हाइपोनेट्रेमिया भी हो जी बेटा हाइपोनेट्रेमिया सोडियम लेवल कम हे जाउची नोजिया वोमिटिंग हबो नोजिया एंड वोमिटिंग हबो हैला देन एब्डोमिनल पेन भी रहइबो बेटा एब्डोमिनल पेन भी रहइबो एब्डोमिनल पेन भी रहइबो इन एडिशन these all are the clinical features with client एडिशन डिजीज जाको हेइतो बेटा हाइपरपिगमेंटेशन थिबो वेट लॉस हबो लॉस ऑफ एपेटाइट हबो हाइपोटेंशन हबो हाइपोनेट्रिमिया हबो नोजिया हबो वोमिटिंग हबो हाइपोनेट्रिमिया हबो लॉस ऑफ एपेटाइट हबो फैटिक हबो वीकनेस हबो these all are the clinical features of addition disease. Next question, question number 565. Which of the following diabetic complication is called the atherosclerotic occlusive disease of lower extremity? Which of the following diabetic complications is called the atherosclerotic occlusive disease of lower extremity? Option A is nephropathy, option B is peripheral artery disease, option C is nephropathy, nephropathy, peripheral artery disease, and option D is retinopathy. So which option is the correct answer? Which option is the correct answer? The correct answer is beta peripheral artery disease. Option B is the correct answer. Next question, question number 566. Addition disease is caused by deficiency of option A ACTH, option B ADH, option C LH and FSH, and option D is cortisol. So which option is the correct answer? Which option is the correct answer? So addition disease is caused by deficiency of cortisol. Option D is the correct answer. Option D is the correct answer. Next question, question number 567. Cut point of fasting blood sugar level indicate the diabetic mellitus. Option A greater than 200 milligram per deciliter. Option B greater than 180 milligram per deciliter. Option C greater than 126 milligram per deciliter, and option D greater than 140 milligram per deciliter. So which option is the correct answer? So cut point of fasting blood sugar FBS, cut point of fasting blood sugar level indicate the diabetic mellitus. So which option is the correct answer? Which option is the correct answer? So correct answer is greater than 126 milligram per deciliter. Option C is the correct answer. Jashashwini Shahu, Prashant Jena, option C. Very good beta, very good. Greater than 126 milligram per deciliter and higher than 126 milligram per deciliter. FVS level indicate the DM, diabetics mellitus. Option C is the correct answer. Very good. Next question. The patient complains for hoarseness of voice. After thyroidectomy, the patient complains for a hoarseness of voice that occurs due to injury in very important for your OSSC nursing officers exam. Option A is injury in superior laryngeal nerve. Option B is injury in anterior laryngeal nerve. Option C is damage in recurrent laryngeal nerve. Option D is injury in inferior laryngeal nerve. So which option is the correct answer? So correct answer is option C. Very good. Option C. Damage in recurrent laryngeal nerve. RLN. RLN. Damage in RLN. And this is the branch of vagus nerve. This is the branch of vagus nerve. Vagus nerve कोटा बेटा cranial nerve 10th. So option C is the correct answer. Next question, question number 569. Early sign of hypoglycemia are which of following? Very, very important. Early signs of hypoglycemia. Early sign of hypoglycemia are which of the following? Option A weight gain, constipations, diarrhea. Option B shaking, shakiness, sweating, nervousness, dizziness. Option C polyuria, headache, diplopia. Option D none of them. So which option is the correct answer? Hypoglycemia means low blood pressure and it can cause, what are the symptoms beta? Shakiness, sweating, nervousness and dizziness. Option B is the correct answer. Very good. Prashant Jena, Shonalika, Yashaswini Shahu, Girish Mahapatra, Snigdha. Very good beta. Very, very thanks and very good. Sumi Behera. So option B is the correct answer. Next question, question number 570. Question number 570 रे कौन अच्छी? How to assess further bleeding after thyroidectomy surgery? Option A is observe for increasing in blood pressure. Option B is observe in decreasing pulse rate. Option C is observe for hemorrhage at operative site. Option D is routinely check the status of CNS. So which option is the correct answer? So correct answer is option C, observe for hemorrhage at operative site. Option C is the correct answer. Next question, question number 571. Ketone bodies are found in urine of patient with uncontrolled diabetes due to option A increased metabolism of fat. Option B decomposition of excess sugar in blood. Option C impaired kidney functions. Option D increased metabolism of protein. So which option is the correct answer? So correct answer is increased metabolism of fat. Option A is the correct answer. But the next question, question number 572. Diabetes insipidus is caused by the deficiency of which of the following hormones? Diabetes insipidus is caused by the deficiency of which of the following hormones? बेटा एबे पढ़ी थी, आंसर करो बेटा, फटाफट आंसर करो, वेरी वेरी इंपॉर्टेंट, आंसर कर दियो मेरे बच्चों, आंसर कर दियो. Option A is antidiuretic ADH. Option B is glucagon. Option C is insulin. Option D is renin. So which option is the correct answer? फटाफट आंसर करो बेटा, निर्भुल भाव में आंसर करबाकू पड़िबो, सटीक उत्तर करबाकू पड़िबो बेटा. So diabetic insipidus is caused by the deficiency of antidiuretic hormone ADH, and ADH is also known as कौन बेटा, known as vasopressin. आना नहीं एबे तो पढ़ी थिले, भूली गले हब कि? अरे अभी अभी तो पढ़े थे, भूल जाने से कैसे होगा? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 573. Kussmal breathing is associated with Kussmal breathing is associated with Kussmal respirations. Kussmal breathing is associated with Kussmal breathing is deep and labor breathing patterns associated with. Option A रचे heart failure. Option B रचे diabetic ketoacidosis. Option C रचे bronchial asthma. Option D रचे atelectasis. So which option is the correct answer बेटा? So this is associated with बेटा diabetic ketoacidosis, DKA है ना नहीं? So Kussmal breathing is a deep and labor breathing pattern. This is associated with metabolic acidosis, and particularly with diabetic ketoacidosis. Option B is the correct answer. Next question, question number 574. Identify a microvascular complication of diabetes mellitus from the following. Identify a microvascular complication of diabetes mellitus from the following. Option A stroke. Option B peripheral vascular atherosclerosis. Option C nephropathy. Option D coronary atherosclerosis. Which option is the correct answer? फटाफट आंसर कर दो, फटाफट आंसर करो यार, फटाफट आंसर कर दो, तमनु सब जना किंतु आंसर करूनो. Which option is the correct answer? So correct answer is nephropathy. So correct answer is nephropathy बेटा, right? Nephropathy causes kidney failure, है ना नहीं, and organ and tissue damage होगा बेटा. So option C is the correct answer. So diabetes is strongly associated with both macro and microvascular. vascular and macrovascular, right? Diabetes is a disease that strongly associated with macro and microvascular complications, right? Macro and microvascular complications, right? So कौन कौन हवा बेटा, नेफ्रोपैथी भी हवा एंड न्यूरोपैथी भी हवा बेटा, नेफ्रोपैथी एंड न्यूरोपैथी, right? These all are the microvascular complication. Nephropathy and neuropathy are microvascular complication, or microvascular complications, right? बुझी पारला बेटा. So option C is the correct answer. Next question, question number 575. कौन अछि the hormone which helps in glycogenolysis? The hormone which helps in glycogenolysis. Each option अछि epinephrine, option अछि trypsin, option अछि estrogen, option D अछि estradiol. So which option is the correct answer? So correct answer is beta epinephrine. Epinephrine. Option A is the correct answer, right? Option A is the correct answer. Next question, question number 576. A patient is diagnosed with gout. Which type of food should be given to the patient? Very, very important. A patient is diagnosed with gout. Which type of food should be given to the patient? Option A low urine diet, option B high iodine diet, option C diabetic diet, option D iron rich diet. So which option is the correct answer? Beta, which option is the correct answer? Gout patient को हमें low urine diet दवा, very good. Low urine diet दवा. नोबिता गांधी, स्निग्धा, option A, very good. Yashaswini Shaw, option A, very good beta. Option A is the correct answer. Next question, question number 577. What is the common pathophysiological mechanism of acute pancreatitis? What is the common pathophysiological mechanism of acute pancreatitis? What is the common pathophysiological mechanism of acute pancreatitis? Option A overproduction of enzymes, option B malabsorption of enzymes, option C acute digestion of autodigestion of pancreas, option D formation of neo beta pancreatic cells. So which option is the correct answer beta? Which option is the correct answer? So option C is the correct answer, autodigestion of pancreas, right? Option C is the correct answer. Next question, question 578. The condition that occurs when oxygen delivery is insufficient to meet metabolic demands is called, correct answer beta. The condition that occurs when oxygen delivery is insufficient to meet metabolic demands is called asphyxia. So option D is the correct answer. तो एस्पेक्सिया रे कौन हुए बेटा, डिफिकल्टी ब्रीदिंग हबो, स्किन कलर केमते जो ब्लू और पेल हे जो बेटा, हार्ट रेट स्लो डाउन हबो, है ना, पेशेंट फैंटिंग हे जो, शॉर्टनेस ऑफ ब्रेथ हबो, ये सब है एस्पेक्सिया रो क्लिनिकल मैनिफेस्टेशन और क्लिनिकल सिम्पटम्स. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 579. Aldosterone is secreted by the dash gland. Important MCQ बेटा, very very important MCQ. जहाँ भी हम देखुचे मोस्ट इंपोर्टेंट एमसीक्यू फॉर योर नॉर्सेट एग्जाम एंड OSSC नर्सिंग ऑफिसर एग्जाम राइट एल्डोस्टेरोन इज सिक्रेटेड बाय द ड्यास ग्लैंड ऑप्शन इज एड्रेनल ऑप्शन बी थायराइड ऑप्शन सी पिट्यूटरी ऑप्शन इज पिनियल ग्लैंड सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा सो करेक्ट आंसर इज एड्रेनल एल्डोस्टेरोन इज सिक्रेटेड बाय द एड्रेनल ग्लैंड राइट Next question, question number 580. Name the condition that is characterized by the combination of an elevated level of serum thyroid stimulating hormone that is TSH and low level of serum free T4 that is thyroxine. Option A is hyperaldosteronism. Option B is hyperthyroidism. Option C is hypothyroidism. Option D is Cushing syndrome. So which option is the correct answer? So correct answer is beta hypothyroidism, right? So name the condition that is characterized by the combination of an elevated level of serum thyroid. So elevated level of serum thyroid stimulating hormones कौन हवा बेटा hypothyroidism रे कौन हवा बेटा increased ठीक रहिबो increased हवा कौन TSH and decreased हवा कोटा बेटा free T4 right ये हैला hypothyroidism रे हवा बेटा hypothyroidism occurs in people who are older than 40 years is called heterogeneous form of diabetes that commonly occurs in people who are older than 40 years is called option A type 1 diabetes mellitus option B type 2 diabetes mellitus option C gestational diabetes mellitus option D impaired glucose tolerance so which option is the correct answer so correct answer is type 2 diabetes mellitus है बेटा next question question number 582 carnic teres so carnic teres which may occur as a complication of jaundice it's a pathological condition of option A liver option B brain option A is liver option B is brain option C is kidney option D is heart so which option is the correct answer बेटा फटाफट आंसर कर दियो carnic teres is a serious complications of jaundice and this is a pathological condition of what बेटा हाई बिलिरुबिन लेवल हो बेटा हाई बिलिरुबिन लेवल हेले कार्निक टेरेस देखियो को मिलुची बेटा हाई बिलिरुबिन लेवल्स है ना हाई बिलिरुबिन लेवल्स हेले कौन हो बेटा कौन हो डैमेज हो which organ damage हो बेटा which organ is damaged which organ is damaged beta which organ is damaged Girish Mahapatra brain very good high bilirubin level हवा जोगो brain निहाती भाବରେ damaged हो बेटा high bilirubin levels damage the brain tissue है ना नहीं next Next question, question number 583. Deficiency of thyroxine in adults leads to a condition called option A tetany, option B cretinism, option C mixed edema, option D Graves' disease. So which option is the correct answer beta? Which option is the correct answer? फटाफट आंसर कर दे बेटा. Which option is the correct answer? So correct answer is mixed edema है बेटा mixed edema. Next question, question number 584. Very important MCQ very important MCQ beta very important MCQ ESIC nursing officers exam 2019 रे जो है थिला बेटा सेतिरे आइस्तिला ई क्वेश्चंस HbA1c indicates post serum glucose levels over previous option A is 6 month period option B is 2 months period option C is 1 month period option D is 3 months period so which option is the correct answer very good जो माने आंसर करूचो 3 months that is correct answer beta option D is the correct answer beta option D is the correct answer over previous 3 months beta option D is the correct answer next question question number 585 tumors within sella torsica and small adenomas of the pituitary glands can be removed through DAS option A infratentorial approach option B transsphenoidal approach option C supratentorial approach option D craniectomy so which option is the correct answer craniectomy Which option is the correct answer, beta? The correct answer is transsphenoidal approach. Option B is the correct answer, beta. Option B is the correct answer. Tumors within the cilia tunica and small adenomas of the pituitary gland can be removed through transsphenoidal approach. Option B is the correct answer, beta. And this is invasive procedure, beta, right? This is invasive procedure. So endoscopic techniques माध्यम रे transsphenoidal surgery करा होची बेटा for proper enhance और visualization पाए, right? endoscopic technique माध्यम रे बेटा, endoscopic technique माध्यम रे transsphenoidal approach को यूज करके सर्जरी करा होची. एंडोस्कोपिक टेक्निक माध्यम रे करला पर कोन होबा प्रॉपर विजुअलाइजेशन होबा बेटा. नेक्स्ट क्वेश्चन नंबर 586. An aged client with diabetes mellitus complaining of painless peripheral loss of vision is at risk for option A is cataract, option B is uveitis, option C is angle closure glaucoma, option D is open angle glaucoma. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is option D, open angle glaucoma. An aged client with diabetes mellitus complaining of painless peripheral loss vision is at risk for open angle glaucoma. Next question number 587. Thyroxine is secreted by, very important, thyroxine is secreted by AIIMS Bhubaneswar senior nursing officers exam रे question size थिला बेटा. Thyroxine is secreted by option A रची the thyroid gland, option B रची the thymus, the option C रची the pituitary gland, option D रची the hypothalamus. So which option is the correct answer? Thyroxine वो T4 भी हमें कुछ बेटा. T4 is secreted by or produced by thyroid gland. Option A is the correct answer. Thyroid gland, Yashashwini Shahu. Option A. Snigdha, thyroid gland. Jasketan, option A. Girish Mahapatra, option A. Very good. Thyroid gland. Next question number 588. Which type of insulin is used for a rapid reduction of glucose? Option A रची short acting, option B रची rapid acting, option C रची intermediate acting, option D रची long acting. So which option is the correct answer, beta? So option B is the correct answer. Rapid acting insulin is used for rapid acting insulin is used for rapid reduction of glucose, right? Option B is the correct answer. Next question. Question number 589. A client is suffering from diabetes mellitus. Which of the following symptoms indicate hyperglycemia? A client is suffering from diabetes mellitus. Which of the following symptoms indicate hyperglycemia? Option A is diaphoresis, dizziness, hunger. Option B is headache, blood, vision, nausea. Option C is polyuria, polydipsia, polyphagia. Option D is oliguria, fluid retention, shortness of breath. So which option is the correct answer, beta? Which option is the correct answer? A client which is suffering from diabetes mellitus, which of the following symptoms indicate hyperglycemia? So correct C option is the correct answer. Option C is the correct answer. Option C होची सठिक उत्तर. Polyuria. Frequent urination due to excretions of excess glucose. Excretions of excess glucose. Polyuria. Excess glucose, polyuria होची excess glucose secretions होची. Hyperglycemia. So option C is the correct answer. Polydipsia, increased thirst. शोष लागिबो बेसी, polyphagia, भोको लागिबो बेसी, increased hunger, polyphagia. So option C is the correct answer, right? Next question number 590. Which of the following combination of adverse effect must be carefully monitored when administering IV insulin to a patient diagnosed with diabetic ketoacidosis? Option A is hyperglycemia and hypernatremia. ऑप्शन बी रही हाइपोकैलेमिया एंड हाइपोग्लाइसेमिया, ऑप्शन सी रही हाइपोकैल्शियमिया एंड हाइपोनेट्रेमिया, and option D रही hyperkalemia and hyperglycemia. So which option is the correct answer beta? Which option is the correct answer? So correct answer कौन होगा? Option B is the correct answer. Option B is the नहीं बेटा, option B होगा correct answer. Hypokalemia and hypoglycemia is the adverse effects to monitor during IV insulin administration for diabetic ketoacidosis. Next question, question number 591. During physical examination, the client's breaths having a fruity odor would help you to suspect. Option A रही albuminuria, option B रही ketoacidosis, option C रही acidity, option D रही proteinuria. So which option is the correct answer? So correct answer is beta option B, ketoacidosis. Option B is the correct answer. During physical examination, the client's breath having fruity odor, and this is you suspect ketoacidosis patients, right? Ketoacidosis, and this is the complications of diabetes. This is the serious complication of diabetic, right? Ketoacidosis. Okay, next questions. Question number 593. Which energy used in cellular metabolism? Option A रही ATP, option B रही ADP, option C रही ASP, option D रही AMP. So which option is the correct answer beta? So correct answer is ATP. Adenosine triphosphate, ATP. ATP energy used in cellular metabolism. नहीं, adenosine triphosphate. Option A is the correct answer. Next question, question number 594. Diagnostic criteria for the syndrome of inappropriate antidiuretic hormone secretion includes all of the following except. Option A रही decreased serum osmolarity, option B रही high urine sodium, option C रही hyponatremia, option D रही decreased urine osmolarity. So which option is the correct answer beta? Which option is the correct answer? So correct answer is decreased urine osmolarity, right? Option D is the correct answer. Next question, question number 595. Causes of hypoglycemia are all of the following except. Option A is fructose intolerance, option B is overdose of insulin, option C is glucagonoma, option D is von Zirek disease. So which option is the correct answer? But option C is the correct answer. Glucagonoma. So glucagonoma, this is a type of pancreatic tumor. This is a type of pancreatic tumor. Pancreatic tumor, right? That overproduce of glucagon. That overproduce of glucagon, right? And it leads to hyperglycemia, and it leads to hyperglycemia, not hypoglycemia. Hyperglycemia होची, right बेटा? Hyperglycemia हबो. ये कौन hypoglycemia देची? All of the following causes of hypoglycemia, all of the following except देची. So glucagonoma हबो. Overdose of insulin हेले hypoglycemia हबो. फ्रुक्टोज इंटॉलरेंस हेले भी हाइपोग्लाइसेमिया हबो. von Zerke disease हेले भी हाइपोग्लाइसेमिया हुए, राइट? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 596. Which of the following is not a feature of type 2 diabetes mellitus? Option A रही the most common type of diabetes mellitus, option B रही insulin dependent diabetes mellitus, option C रही adult onset diabetes mellitus, option D रही endogenous insulin production is present. So which option is the correct answer? So correct answer is beta option B is the correct answer. Insulin dependent diabetes mellitus. This is not a feature of type 2 diabetes mellitus, right? Insulin dependent diabetes mellitus. So option B is the correct answer. So type 2 diabetes mellitus is non-insulin dependent. Non-insulin कौन बेटा डिपेंडेंट DM on non-insulin dependent DM. This is a non-insulin dependent DM. So insulin dependent diabetes mellitus is not a feature of type 2 diabetes mellitus. Option B is the correct answer. Next question, question number 597. All of the following conditions are included in the HHNS triad except option A volume depletion, option B elevated serum osmolarity, option C severe hyperglycemia, option D ketonemia and acidosis. So which option is the correct answer? HHNS ର full form कौन बेटा? HHNS ର full form कौन? hyperosmolar hyperglycemia, hypoglycemic and non-ketotic syndrome. Already ମୁଁ କହି ସାରିଛି ବେଟା previous class ମାନଙ୍କରେ HHNS ର full form and also known as hyperglycemic test. याको कौन कहती? hyperosmolar और कौन कहती बेटा? और hyperosmolar hyperglycemic state मध्य कहती HHS भी कहती, right? So which option is the correct answer beta? Which option is the correct answer? So correct answer is option D, ketonemia and acidosis. Ketonemia and acidosis सब यार correct answer. So ketonemia and acidosis means beta DKA, diabetic ketoacidosis, right? DKA, diabetic ketoacidosis, right? Except कोई बेटा, except कोई तो shape में, right? So all are the condition include in the HHNS, that is volume depletions, elevated serum osmolarity and severe hyperglycemia. These all are the condition include in the HHNS or hyperosmolar hyperglycemia state, right? So option D is the correct answer beta. Next question, question number 598. A patient with diabetes mellitus has a blood glucose level of 644 mg per deciliter. The management of this patient would include all of the following except option A IV fluids, option B IV insulin infusion, option C correction of metabolic acidosis, option D IV corticosteroid. So which option is the correct answer? So which option is the correct answer beta? So correct answer is option D beta, IV corticosteroid, right? Except याको छाड़ी दिले beta, all are the management of diabetic mellitus patients. और तारा ब्लड ग्लूकोज लेवल केते अछि 644 मिलीग्राम पर डेसिलिटर. IV fluid देबाक पड़बो, IV इंसुलिन इन्फ्यूजन करबाक पड़बो एंड करेक्शन ऑफ मेटाबॉलिक एसिडोसिस. सो ऑप्शन डी को छाड़ी देले, बाकी ऑल आर द मैनेजमेंट ऑफ these patients, right? So option D is the correct answer. Next question, question number 519. Clinical features of DKA except. Clinical features of DKA except. So option A is present and gave, option which blood glucose level 300 to 500 milligram per deciliter, option C is decreased bicarbonate level, option D is breathing normal. So which option is the correct answer? Which option is the correct answer? So correct answer is option D, breathing normal. This is not a clinical features. This is not a clinical features of DKA, right? Next question, question number 600. The fight or flight response. The fight or flight response is characterized by the following except. Option A is increase in oxygen intake, option B is increase in blood pressure, option C is increase in cardiac output, option D is mental alertness. So correct answer is beta option C is the correct answer. Option C is the correct answer. Decrease in cardiac output. This is not the characteristics of a fight or flight response, right? So option C is the correct answer. Next question, question number 601. The following statement is true in the following statement is true in the reference to end toxins except. The following statement is true in reference to end toxins except. Option A रचित they are lipopolysaccharides in nature. Option B रचित they are released from the bacterial surface by natural lysis. Option C रचित they are heat labile proteins. Option D रचित their toxicity depends in the lipid components. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option C. Option C is the correct answer beta. They are polysaccharides in nature. This is the true statements reference to end toxin. Regarding end toxins, they are released from the bacterial surface by natural lysis. These are this statement also refer to end toxins. Then their toxicity depends in the lipid component. This is also the true statement about end toxins, right? Endotoxins beta, endotoxins, reference to endotoxins, not endotoxins, endotoxins, right? Next question, question number 602. Which of the following is not a modifiable risk factor in the case of diabetes? Option A is age, option B is salt intake, option C is alcohol intake, option D is obesity. So which option is the correct answer? Which option is the correct answer beta? फटाफट आंसर कर दे बेटा. So correct answer is option A. This is non-modifiable factors, right? Salt intake modify करिवे हबो, alcohol intake को modify हबो, अना नहीं. ओबेसिटी को भी मॉडिफाई करी हबो बेटा, हाँ ना नहीं, बट एज को हमें मॉडिफाई करी पारे. दिस इज नॉट ए मॉडिफाइबल रिस्क फैक्टर इन द केस ऑफ डायबिटीज. ऑप्शन ए इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 603. A nurse is giving discharge advice for a patient with hypothyroidism. Which one of the following would be a wrong advice to give? Option A is avoid exposure to cold temperature. Option B is plant diet intake with high fiber, low calorie diet. Option C is stop medical regimen when the values are normal. Option D is mandatorily have follow-ups visits. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option C is the correct answer. Option C is the correct answer. This is so stop medical regimen when the values are normal, right? This is the wrong advice to give the patients, right? So option C is the correct answer. Next question, question number 604. Feature of hypothyroidism except. Option A is tetany, option B is muscles weakness, option C is weight gain, option D is constipation. फटाफट आंसर कर दे बेटा, फटाफट आंसर कर दे, प्लीज 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 फटाफट आंसर करो. tetany, option B is muscles weakness, option C is weight gain, option D is constipation. Feature of hypothyroidism एबे सब पढ़िथिले पर एबे सब कहिथिले बेटा किछि समय पूर्व. एक्सेप्ट constipations हबो कि नहीं, weight gain हबो कि नहीं हबो, लो कैल्शियम लेवल जोगु और हाइपोकैल्सीमिया जोगु कौन हबो बेटा, स्पाजम हबो, क्रैम्प्स हबो, टिटानी हबो, है ना नहीं. ये सब all are the features of hypothyroidism except कौन muscles weakness, right? Muscles weakness. Next question, question number 605. which of the following sign would not be seen in diabetic ketoacidosis? ठीक है, ऑप्शन ए रही हाइपरग्लाइसेमिया, ऑप्शन रही लो एनाइन गैप, ऑप्शन सी रही लो बाइकार्बोनेट, ऑप्शन रही फ्रूटी ऑर्डर्स ब्रीथ. रिपीट ହେଇଗଲା ना कौन ये सब क्वेश्चंस. which option is the correct answer बेटा? so correct answer is बेटा option B. not be seen in diabetic ketoacidosis, low anion gap, right? Option B is the correct answer. Next question number 1696. All the following are true about phenylketonuria except. All the following are true about phenylketonuria except. Option A deficiency of phenylalanine hydroxylase. Option B mental retardation. Option C increased urinary excretions of p-hydroxyphenyl pyruvic acid. Option D decreased serotonin formation. So which option is the correct answer beta? Which option is the correct answer? So फटाफट आंसर कर देना. So correct answer is beta increased urinary excretion of p-hydroxyphenyl pyruvic acids, right? Option C is the correct answer. Next question number 607. Which of the following is a preventive measure for parotitis? Very important. Which of the following is a preventive measures for parotitis? Option A warm compress, option B chewing gum, option C antibiotics, option D defective action. So which option is the correct answer? Which option is the correct answer beta? So correct answer is chewing gum. So preventive measures for parotitis को आउ कौन कहते बेटा? mumps, not diets, mumps. parotitis को mumps मध्य कहते है ना. So preventive measures for parotitis or mumps is chewing gum. Option B is the correct answer. Next question number 608. What is the excessive production of saliva called? Very important MCQ. Very important MCQ. What is the excessive production of saliva called? Option A hypersalivation, option B dry mouth or xerostomia, option C slip bruxism or teeth grindings, option D dry eye or keratoconjunctivitis sicca. ड्राई माउथ को कौन कहते बेटा? जेरोस्टोमिया. स्लिप ब्रूइज्म को कौन कहते बेटा? टीथ ग्राइंडिंग्स. जने सोइला बेले दांत कामुड़ांती ने, दांत को पूरा कामुड़ांती. दैट इज स्लिप ब्रूइज्म. टीथ ग्राइंडिंग कट नहीं, दांत कामुड़ांती. देन ऑप्शन डी ड्राई आई कौन कहते बेटा? keratoconjunctivitis sicca, right? What is the excessive production of saliva called? So correct answer which? hypersalivations को आउ कौन कहते बेटा? जानी चकी टाइलिज्म कहते बेटा. टाइलिज्म TYLISM टाइलिज्म. Hypersalivations is otherwise known as tylism or sialoria. आउ कौन कहती बेटा? sialoria. SIALORRHEA. sialoria और tylism कहती. hypersalivation, tylism और sialoria. It is excessive production of saliva. Hypersalivation and tylism and sialoria, right? Next question number answer जानला था बेटा? Option A is the correct answer. Next question number 609. Which infectious agent is a risk factor for the development of stomach cancer? Which infectious agent is a risk factor for the development of stomach cancer? Very important MCQ. Very important MCQ बेटा. This is very important MCQ. Option A Helicobacter pylori, option B E. coli, option C Shigella, option D Salmonella. So which option is the correct answer beta? So correct answer is Helicobacter pylori or H. pylori कहते बेटा. H. pylori or Helicobacter pylori. पाइलोरी पाइलोरिया नहीं बेटा पाइलोरी सॉरी सो ऑप्शन ए इज द करेक्ट आंसर ऑप्शन ए इज द करेक्ट आंसर राइट ऑप्शन ए इज द करेक्ट आंसर बेटा next question number 610 which of the following best describe the H type of TEF H type of TEF option A EA with distal TEF tracheo esophageal fistula tracheo esophageal fistula beta TEF right so EA with distal TEF option will be EA with both proximal and distal TEFs EA means beta esophageal atresia right EA means esophageal atresia right so EA with both proximal and distal TEFs option C is EA TEF without and EA option D is EA with proximal TEF so which option is the correct answer beta so correct answer is option C beta option C is the correct answer TEF without and EA right next question number 611 which laboratory findings is most consistent with inhalation injury which laboratory findings is most consistent with inhalation injury option A is decrease partial carbon dioxide with respiratory alkalosis option B is elevated carboxy hemoglobin levels option C is elevated serum amylase option D is low hematocrit so which option is the correct answer beta so correct answer is beta option B elevated carboxy hemoglobin levels right option B is the correct answer this findings is most consistent with inhalation injury right next question number 612 NIMHANS is feature of option A रचे Mallory-Weiss syndrome option B रचे Boyer-Haves syndromes option C रचे diverticulosis option D रचे achalasia cardia so which option is the correct answer beta NIMHANS a feature of crunching sounds beta this is a crunching sound by heart murmur crunching sound in heart murmur sound আছে না बेटा heart murmur केतेबेले हुए बेटा when rupture of the esophagus हेले होची बेटा कौन हवा बेटा so Boyer-Haves syndrome हवा Boyer-Haves syndrome रे rupture of esophagus हेले NIMHANS आसीबा बेटा rupture of esophagus right Boyer-Haves syndromes crunching sound आसीबा heart murmur sound आसीबा बेटा heart murmur sound asibo next question number 613 the prominent pulsating mass in the abdomen is a characteristic feature of option A abdominal aneurysm option B appendicitis option C thoracic aneurysm option D liver cirrhosis so which option is the correct answer beta which option is the correct answer फटाफट आंसर कर दे बेटा which option is the correct answer so correct answer is बेटा option A is the correct answer option A is the correct answer abdominal aneurysm right this is the clinical features of prominent pulsating mass in the abdomen it's a characteristic features of abdominal aneurysm right option A is the correct answer beta Next question, question number 614. Intrinsic factors and hydrochloric acid are produced by very important MCQ. Answer करो बेटा. Intrinsic factors and hydrochloric acid HCl. Intrinsic factors and hydrochloric acid are produced by option A mucosal neck cells, option B zymogen cells, option C parietal cells, option D chip cells. So which option is the correct answer? So correct answer is beta parietal cells. Option C is the correct answer, parietal cells. Answer करो बेटा, फटाफट answer करो. Parietal cells. Which option is the correct answer? So correct answer is parietal cells, right? Next question. Which is the smallest and most numerous type of tongue papilla? Option A filiform, option B fungiform, and option C foliate, option D circumvallate. So which option is the correct answer? So correct answer is beta option A is the correct answer, filiform. Filiform papilla. This is the smallest and most numerous type of tongue. This is the smallest and most numerous type of tongue. Filiform papilla. Filiform papilla is the smallest and most numerous type of tongue. Most numerous type of tongue papilla. Next question, question number 616. In which condition is the lining of the esophagus mucosa altered due to chronic untreated GERD and can lead to esophageal cancer? Option A Chagas esophagus, option B Barrett's esophagus, option C Davis esophagus, option D Ehlers esophagus. So which option is the correct answer? So correct answer is Barrett's esophagus. Right. Next question, question number 617. A patient presented with swelling in front deglutitions, which among the following will be the less likely diagnosis? Option A thyroglossal cyst, option B solitary thyroid nodule in isthmus, option C subhyoid bursitis, option D lipoma. So which option is the correct answer? So correct answer is lipoma. A patient presented with swelling in front of deglutitions and among the following will be the less likely diagnosis, lipoma. So option D is the correct answer. Deglutition, this is a process of swallowing. Deglutition means this is the process of swallowing. Process of swallowing. Okay. Deglutition means कौन है बेटा? Process of swallowing. So option D is the correct answer. Next question, question number 618. Which of the following is the organism that causes peptic ulcers disease? Which of the following is the organism that causes peptic ulcers disease? Option A is Staphylococcus, option B is Corneobacterium, option C is Helicobacter pylori, option D is Streptococcus. So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option C, Helicobacter pylori. This organism that causes peptic ulcer disease. Causative organisms of peptic ulcer, right? Next question, question number 619. Which of the following statements is or are correct about viral hepatitis? Which of the following statement is or are correct about viral hepatitis? Option A, viral hepatitis A can be transmitted through water. Option B, viral hepatitis B can be transmitted from mother to baby. Option C, viral hepatitis C is parenterally transmitted. Option D, all of the above are correct. So which option is the correct answer beta? Which option is the correct answer? Which option is the correct answer? सो हेपाटाइटिस ए बेटा केमती ट्रांसमिटेड हुए हेपाटाइटिस ट्रांसमिटेड थ्रू hepatitis A transmitted through food and via fecal route हाँ ना नहीं hepatitis A can be transmitted through not water beta through sorry hepatitis A can be transmitted through contaminated water and food and food hepatitis A can be transmitted through contaminated water and food and via केमती असे बेटा fecal oral route है ना नहीं then hepatitis B can be transmitted from mother to baby hepatitis B can be transmitted from mother to baby during childbirth है ना नहीं during childbirth or through sexual contact है ना नहीं and sharing contaminated needle हाँ कि नहीं contaminated needle भी शेयर कर ले अब hepatitis B hepatitis C viral hepatitis C is parenterally transmitted so hepatitis C is parenterally transmitted and parenteral routes कौन करना बेटा through blood transfusion हाँ ना नहीं sharing contaminated needles bodily fluid contaminated needle शेयर कर ले भी हवा बेटा हाँ ना नहीं and bodily fluid यही सब माध्यम रे पेरेंटल रूट माध्यम रे हेपेटाइटिस सी transmitted हवा so all of the above are correct option D is the correct answer all statements are correct beta सब statement correctly लिखा अछि next question number 620 a patient may suffer from upper GI tract obstruction what would be the priority nursing action option A is elevate the head side of the bed option B is elevate foot side of the bed option C is start oxygen therapy option D is give side lying position so which option is the correct answer so correct answer is beta option A is the correct answer elevate the head side of the bed so patient may suffer from GI tract obstruction what would be the priority nursing actions means beta elevate the head side of the bed option A is the correct answer next question number 621 the substance deposited in skin and sclera in jaundice itch the substance deposited in skin and sclera in jaundice itch option is indirect or unconjugated bilirubin option which is direct or conjugated bilirubin option is biliverdin option is stercobilin so which option is the correct answer very important MCQ but a very important MCQ for your upcoming exams so correct answer is beta option A indirect or unconjugated bilirubin एक क्वेश्चंस बेटा OSSC नर्सिंग ऑफिसर एग्जाम 2023 मसिया रे जो एग्जाम हेतिला 19 तारीख मार्च मास 19 तारीख दिन जो एग्जामिनेशन हेतिला से एग्जाम रे एक क्वेश्चंस आइतिला बेटा द सब्सटेंस डिपोजिटेड इन स्किन एंड स्क्लेरा इन jaundice itch indirected or unconjugated bilirubin so option A is the correct answer beta right next question number 622 question number 622 the skin usually begins to appear jaundice when plasma concentration of bilirubin rises dash than normal option A is 2 times option B is 3 times option C is 4 times option D is 5 times so correct answer is beta 3 times, right? Option B is the correct answer. The skin usually begins to appear jaundice when plasma concentration of bilirubin rises 3 times than normal. Next question number, Murphy sign is positive in, very important MCQ. Murphy sign is positive in, आंसर कर दिया बेटा. ऑप्शन रही कोलेसिस्टाइटिस, ऑप्शन रही एपेंडिसाइटिस, ऑप्शन सी रही डाइवर्टिकुलाइटिस, ऑप्शन रही नेफ्राइटिस. एबे किछि समय पूर्व मु पढिथिली बेटा. आंसर कर दियो प्लीज आंसर द क्वेश्चंस, आंसर द above questions, answer the above questions, answer the question which is showing in your mobile screen or which is showing on your mobile screen and your mobile screen or your personal computer or your tab. कौन आसी बेटा करेक्ट आंसर कौन आसीबो? Which option is the correct answer? The correct answer is cholecystitis. Very good. Cholecystitis. Grish Mahapatra, Sonalika, Jasashwini Sahu, Lipun Mahakud, Prashant Jena, Gayatri Shwain. Grish Mahapatra. Cholecystitis. Cholecystitis. Right. Option A is the correct answer. Cholecystitis. Inflammation of gallbladder. नहीं, inflammation of gallbladder. Inflammation of gallbladder. Inflammation of gallbladder बेटा. Right? Cholecystitis. Next question number 624. In urea breath test, Excel breath is used to detect the presence of. Answer करो बेटा फटाफट. Most important MCQ सब हम पढ़ुचे. In urea breath test, Excel breath is used to detect the presence of. Option A रचे Escherichia coli or E. coli. Option B रचे Streptococcus. Option C रचे Staphylococcus. Option D रचे Helicobacter pylori. So which option is the correct answer? So correct answer is बेटा Helicobacter pylori. H. pylori. Helicobacter pylori. So option D is the correct answer. Next question number 25. Fleeting abdominal pain due to follicular bleeding causing peritoneal irritations is called as. Fleeting abdominal pain due to follicular bleeding causing peritoneal irritations is called as. Option A is corpus hemorrhagicum. Corpus hemorrhagicum. Option B is mitral scamarch. Option C is corpus luteum. Option D is corpus albicans. So which option is the correct answer? So correct answer is beta option B is the correct answer. Mitral scamarch. Mitral scamarch is the correct answer. This is the fleeting abdominal pain caused by follicular bleeding and leading to peritoneal irritations. It's called mitral scamarch. Right? Option B is the correct answer. Next question number 626. Memory degenerations. Memory degeneration seen in alcoholic liver disease is a form of. Option A is hyaline degeneration. Option B is amyloid degeneration. Option C is hydropic degenerations. Option D is fatty degenerations. So which option is the correct answer? Which option is the correct answer? So correct answer is hyaline degeneration. So option A is the correct answer. Memory degeneration seen in alcoholic liver disease is a form of hyaline degenerations, right? Next question number 627. Hepatic coma. Hepatic coma is due to the elevated plasma level of. Hepatic coma is due to the elevated plasma level of. Option A is amylase. Option B is ammonia. Option C is albumin. Option D is adenosine. So which option is the correct answer? Which option is the correct answer? Which option is the correct answer? Which option is the correct answer beta? Which option is the correct answer? So correct answer is beta option B, ammonia. It's also known as NH3. NH3 को ammonia कहते बेटा नहीं. So it is a waste product and it is produced after digestion of protein in the intestine. हाँ ना नहीं? After digestion of protein in the intestine है ना नहीं so hepatic coma due to the elevated plasma level of ammonia है ना नहीं next question number 628 excess bilirubin in the plasma causes option A रचे cyanosis option B रचे jaundice option C रचे cystic fibrosis option D रचे leukemia so which option is the correct answer so correct answer is beta jaundice simple questions next question number 629 how to prevent discoloration of teeth after iron syrup injections very important tricky questions how to prevent discoloration of teeth after iron syrup injections option A is syrup given after food option B is syrup given with full glass of water option C is syrup given with citrus fruits juice option D is syrup given through straw so which option is the correct answer करो बेटा फटाफट आंसर करो बेटा ऑप्शन बी was how to prevent discoloration of teeth after iron syrup injections syrup पी सारला पर कौन करवार अछि ताहले हमें प्रिवेंट करि परबा discoloration of teeth syrup given with full glass of water option D is the correct answer option B is the correct answer beta option B is the correct answer ना so option B is the correct answer next question number 630 lactulose syrup in chronic liver disease is given lactulose syrup in chronic liver disease is given option A is to prevent hepatic encephalopathy option B is to prevent diarrhea option C is to prevent kidney damage option D is to prevent liver damage so which option is the correct answer beta lactulose syrup in chronic liver disease is given to prevent hepatic encephalopathy to prevent diarrhea to prevent kidney damage to prevent liver damage so correct answer is beta to prevent hepatic encephalopathy option A is the correct answer right to prevent hepatic encephalopathy lactulose syrup is commonly used in the management of chronic liver disease to prevent hepatic encephalopathy right next question number 631 characteristics of the stool in a patient with cystic fibrosis very important MCQ beta very important MCQ मान रखे था characteristics of the stool in a patient with cystic fibrosis option A रचे steatorrhea option B रचे clay color stool option C रचे dark color stool option D रचे bloody stool so correct answer is beta option A is the correct answer steatorrhea is the correct answer option A is the correct answer next question number 632 a patient with diabetes mellitus is on regular insulin which is administered in the morning at 9 a.m. peak time of regular insulin reach at option A 10 to 30 a.m. option B रचे 12 p.m. option C रचे 4 p.m. option रचे 10:30 a.m. so which option is the correct answer so peak time of regular insulin is 3 to 4 hours right on an average 3 hours 3 to 4 hours peak time of regular insulin right so injection time कितने बेटा 9 a.m. आना नहीं So injection time 9 am plus peak time केते बड़ा 3 to 4 hours मानो एवरेज 3 hours आमे धरुचे है ना 3 hours तो 9 plus 3 केते हला बेटा 12 pm हवा है ना नहीं so option B is the correct answer. Next question number 633 in obstetric liver disease which one of the following test of liver function likely remains normal? In obstetric liver disease which one of the following test of liver function likely remains normal? Option A AST and ALT. Option B is alkaline phosphatase. Option C is albumin. Option D is 5 nucleotidase and Y glutamyl transpeptidase. So which option is the correct answer? So correct answer is option C, albumin have a correct answer, right? In obstetric liver disease albumin is one of the following test of liver function likely remains normal, right? Option C is the correct answer. बाकी देखो एबनॉर्मल रहिबो निहाती भाव रे राइट. Next question number 634. A patient develop pernicious anemia after total gastrectomy surgery. A patient develop pernicious anemia after total gastrectomy surgery. Which of the following medicine would be prescribed to prevent complication in this patient? Option A is daily iron supplements. Option B is folic acid. Option C is lifelong administration of oral intrinsic factors. Option D is lifelong administration of vitamin A, vitamin B12 injections for every month. So which option is the correct answer beta? So correct answer is option D, right? Lifelong administration of vitamin A, vitamin B12 injection for every month, right? In pernicious anemia after total gastrectomy surgery, right? This is to prevent complication in these patients. So हमको प्रत्येक मासरे vitamin A and vitamin B12 injection नवा को पड़ेगा lifelong, right? Option D is the correct answer. But next question number 635. Which of the following is not among the 7 FS etiological factors of abdominal distensions? 7 FS कौन कौन बेटा 7 FS? Fat, obesity, right? Then fluid, then flatus, that is yes. Then feces, constipations over beta, abdominal distension, feces, right? Then fetus in pregnancy, right? How कौन होचे बेटा? F for fatal, growth or tumor, and lastly fantastical, that is psychiatric causes. हेला 1 2 3 4 5 6 और 7 FS of abdominal distension. 7 FS of abdominal distensions. F for fat, that is obesity. F for fluid, and F for flatus, that is gas. F for feces, constipation sabo. F for fetus in pregnancy. F for fatal, growth or tumor haba beta. And 7th ray fantastical, that is psychiatric causes. These all are the mnemonics. That is 7 FS refers to common cause of abdominal distension, right? But fatigue is not a part of 7 FS abdominal distension. So option D is the correct answer. Option D is the correct answer. Next question, question number 636. Glossitis means बेटा आंसर करो बेटा, एटा तमरो क्वेश्चंस रो आंसर बेटा. Glossitis means फटाफट आंसर करो बेटा, मु आंसर करबिनी. Glossitis means inflammation of the tongue. Option B is inflammation of gums. Option A is inflammation of the tongue. Option B is inflammation of gums. Option C is inflammation of lips. Option D is inflammation of nose. So which option is the correct answer? फटाफट आंसर करो बेटा, फटाफट आंसर कर दियो. अरे यार फटाफट आंसर कर दो ना भाई, फटाफट आंसर कर दो, आंसर कर दो फटाफट, आंसर कर दो बेटा. इन्फ्लामेशन ऑफ नोज कौन है बेटा? राइनाइटिस, राइनाइटिस कौन है बेटा? इन्फ्लामेशन ऑफ म्यूकस मेम्ब्रेन ऑफ द नोज, राइट, दैट इज राइनाइटिस. इन्फ्लामेशन ऑफ लिप्स, इन्फ्लामेशन ऑफ लिप्स, चिलाइटिस, अरे नहीं चिलाइटिस. इन्फ्लामेशन ऑफ गम्स, gingivitis, है नहीं, and inflammation of the tongue, glossitis, है ना नहीं. So correct answer is option A is the correct answer. है ना नहीं, आंसर कर लो ना. नहीं भाई आंसर करो यार, तुम लोग आंसर नहीं करोगे तो कैसे होगा. So correct answer is option A. Very good. Option A is the correct answer. Next question, question number 637. Which type of hepatitis is called serum hepatitis? Which type of hepatitis is called serum hepatitis? Option A रचे hepatitis A, option B रचे hepatitis B, option C रचे hepatitis C, option D रचे hepatitis D. So correct answer is option B. Option B is the correct answer. Hepatitis B is known as serum hepatitis. Serum hepatitis. Next question, question number 638. Which tapeworm infection causes cystic cirrhosis? Which tapeworm infection causes cystic cirrhosis? Option A is Taenia solium. Option B is Taenia saginata. Option C is Taenia asiatica. Option D is Taenia saphita. So which option is the correct answer beta? So which option is the correct answer? So correct answer is Taenia solium. Taenia solium, right? Option A is the correct answer. Option A is the correct answer. Next question, 639. Identify the toxin that is released by the Helicobacter pylori in peptic ulcer. Option A COX-1. Option B is XAGA or XAVV. Option C is XCAGA or VACA. Option D is FAGB or FAVV. So which option is the correct answer beta? So correct answer is option C is the correct answer beta, right? Next question, question number 640. Which of the following factors is common cause of fatty diarrhea? Which of the following factors is common cause of fatty diarrhea? Option A is lactose intolerance. Option B is celiac disease. Option C is bacterial and viral infections. Option D is sucrose intolerance. So which option is the correct answer? So correct answer is beta option B is the correct answer. Celiac disease. Celiac disease. Celiac disease. Right. So fatty diarrhea is otherwise known as स्टेटोरिया कौन थे बेटा? स्टेटोरिया कौन थे? स्टेटोरिया कौन थे बेटा? स्टेटोरिया. And this refers to diarrhea and presence of excessive fat in the stool. It's celiac disease. Presence of excessive fat in the stool is celiac disease. Celiac digit. Option B is the correct answer beta. Next question, question number 641. What is the acute cholecystitis? What is the acute cholecystitis? Option A is inflammation of stomach, option B is inflammation of intestine, option C is inflammation of gallbladder, option D is inflammation of spleen. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दिया. So correct answer is option C, inflammation of gallbladder. Next question, question number 642. Which is the most common type of hepatic cirrhosis? Option A is post necrotic cirrhosis, option B is biliary cirrhosis, option C is alcoholic cirrhosis, option D is medicine cirrhosis. So which option is the correct answer beta? So correct answer is alcoholic cirrhosis. Option C is the correct answer. Next question, question number 643. Absence of bowel sound and abdominal distension after abdominal surgery indicates. Option A is hemorrhage, option B is intussusception, option C is paralytic ileus, option D is flatulence. So which option is the correct answer? So correct answer is beta paralytic ileus. So option C is the correct answer. Absence of bowel sound and abdominal distension after abdominal surgery indicates paralytic ileus. Right? Very important MCQ. Very important. Next question, question number 644. Diabetes it relates to. Option A is blood sugar, option B is creatinine, option C is blood cells, option D is blood pressure. So which option is the correct answer? So which option is the correct answer beta? Which option is the correct answer? So correct answer is beta blood sugar. Diabetes it relates to blood sugar, not creatinine, not blood cells, not blood pressure. Right? Option A is the correct answer. Next question, question number 645. In a planned gastrectomy, which is essential component to assess? In a planned gastrectomy, which essential component to assess? Option A is hemoglobin, option B is vital sign, option C is albumin level, option D is urine output. फटाफट आंसर कर दे बेटा. Which option is the correct answer? So gastrectomy, plan for gastrectomy surgical procedure, which component is essential to assess? आंसर करो बेटा फटाफट आंसर करो फटाफट आंसर कर दो. So correct answer is option A beta hemoglobin. Hemoglobin is the correct answer. Next question. Next question, question number 646. Common clinical features of intestinal obstructions. Very important. Common clinical features of intestinal obstruction. Option A is bilious vomiting, option B is diarrhea, option C is fever, option D is all of the above. So which option is the correct answer? Bilious vomiting. Option A is the correct answer. Next question, question number 647. A patient on long-term antibiotics therapy with loss of GI flora may chance of. Option A is diarrhea, option B is platelet inhalation, option C is bleeding, and option D is all of the above. So which option is the correct answer? So correct answer is option A, diarrhea. Patient on long-term antibiotics therapy with the loss of GI flora may chance of diarrhea. Right? Next question, question number 648. A patient has peptic ulcer and taking antacid. Patient has peptic ulcer and taking antacid. What is the action of antacids? Option A is decrease HCl secretion, option B is increase HCl, option C inhibits ACH, option D neutralize the HCl. So फटाफट आंसर कर लो बेटा फटाफट आंसर कर दो. एंटासिड्स रिएक्शंस कौन है बेटा? एंटासिड्स रिएक्शंस कौन? सो एंटासिड्स कौन करे बेटा? Neutralizing the excess hydrochloric acids present in the stomach. हाँ ना नहीं? So correct answer is option D. Option D is the correct answer. Very good, Sonalika. Next question. 649. A patient has GI bleeding with clot BP 80/40 mm of Hg. Priority nursing action is. Option A prepare for surgery. Option B intravenous resuscitations. Option C administer oxygen. Option D maintain airway. So which option is the correct answer beta? So correct answer is intravenous resuscitations. IV resuscitations. Patient has GI bleeding with clot BP 80/40 mm of Hg. Priority nursing action is intravenous resuscitations. Right? Next question, last question beta. आज की क्लासेस का last questions. Right? आंसर कर दिया फटाफट. Pulse sleep breathing assist in. Pulse sleep breathing assist in. ऑप्शन ए एक्सपेंशन ऑफ डायफ्राम, ऑप्शन बी इंक्रीज ब्रीदिंग पावर, ऑप्शन सी इंक्रीज एलिमिनेशन ऑफ कार्बन डाइऑक्साइड, ऑप्शन डी इंक्रीज इनहालेशन ऑफ ऑक्सीजन. सो व्हिच ऑप्शन इज द करेक्ट आंसर? व्हिच ऑप्शन इज द करेक्ट आंसर बेटा? First, lip breathing. It's a technique to used slow down breathing, right? Technique to used slow down breathing and increase the amount of air exhale and improve oxygen exchange. So which option is the correct answer beta? Which option is the correct answer? So correct answer is option C, increases elimination of carbon dioxide. Option C is the correct answer. Option C is the correct answer. Very good, very good, very good, very good. Prashant Jena, Iti Shuna, Gayatri Shwai, Sonalika, Jyotirmayi Shamanta, Girish Mahapatra. Very good. Thank you so much. And God bless you to one and all beta. Asanta kale pune class kariba 8 PM re samaste join he jiba beta. Right? So 8 PM for nursing officers and 6 PM for A&M classes, right? So जो मैंने आजकल क्लासेस रे जॉइन हेतला से माननको पाए मो भगवान वगैरह प्रेयर करूची समस्तंकर जेमती गवर्नमेंट जॉब हे जाओ एई OSSC नर्सिंग ऑफिसर रिक्रूटमेंट एग्जाम रे एक क्रैक हे जो सिलेक्शन से जाओ सेति पय प्रेयर करूची तमनंग पाए. तो निहाती भाव रे तमनकर सिलेक्शन से जिवो. So पाठ पढ़ा को कंटिन्यूटी रखो बेटा without distractions. Distract one ए समय this is crucial period for you. निहाते भाव रे पाठ पढ़ा को कंटिन्यू रखो, right? And live classes आसो निजे सेल्फ स्टडी करो बेटा, निजे भी पढ़ो, निजे भी किसी क्वेश्चंस देखो. Okay, good night Sonalika, good night to one and all the best for your upcoming OSSC nursing officers exam. Okay बेटा, and stay motivated beta and keep your study continue, right? Thank you so much. Okay, पुणी थरे देखा आसंता काली 8टा बेले से पर्यंत टेक केयर एंड बाय बाय.